risen. That's why we can see things. I do have a college degree. Every Thursday, we set aside some time to talk to the medical community. Today, we talk with Dr. Doug Waldrep, who's here from the Hanover Regional Medical Center, speaking about mental health and some things that you need to know. Well, let's first of all welcome. I know this is a special occasion for you. We'll talk more about that momentarily.
Sure.
But when it comes to mental health, right off the bat, what are some of the misconceptions that the general public has?
Well, I'm glad you bring that up, Bob. First, thank you for having me come on board here. It's great to be able to talk about mental health issues because even in the 21st century, there is so much misinformation, and we need to clarify that so that people can get the help that they really want. I would think one of the most common misinformations is that people believe that around Christmas and the holidays is a big time for suicide. Well, in fact, that's not the case. Since the 1800s, I've been studying suicides, and the biggest time for suicide is actually the springtime, May, this month, which may be the reason why we're doing the mental health awareness. And so there's several reasons for that, but it's just something important to know that this is a time to be aware of different things. Another thing that I think a lot of people run into is when someone's feeling down and not able to maybe get their job done, or they're irritable with their family, someone will say, hey, pop out of it. Well, if you could pop out of it, you probably would have done that an hour ago. So it doesn't happen. And so you're left with this frustration and feeling worse, like, what is wrong with me? I can't pop out of this thing.
It seems like nowadays, so many times in the headlines, we'll hear of an adult or a child, and you'll hear people say, you know, if I had only acted earlier. What are some of the key things that we need to look for, the telltale signs that there may be an issue?
I think that's an excellent question. I think the key word there is awareness, and not necessarily look for labels to label somebody with. If you look at what you want to follow is a trend. How is someone doing on a day-to-day basis? We all have times when we're frustrated, angry, upset, depressed about things in our life. But what you're looking for is how many days in a row is this happening? Is it starting to affect my relationships? Is it starting to affect my job? Is it starting to affect my own body? Am I getting sicker? Am I feeling like I have less energy? And the important thing is also listen to the folks around you. Those who love you and care for you, if they kind of notice something like, you know, hey Doug, you know, you just seem a little bit more tired lately, I probably ought to listen to that, because they're seeing something that I'm not seeing right now. And that's usually the case. Our families will see it before we do. I think it's important to realize too that mental illness is an illness like any other illness, and our brain, which has most of our emotions, is like any other organ. It's an organ in our body, and if it's not functioning right, we can have depression, anxiety, and all kind of things that go on like that. So we've got to be aware of that.
I always mention to people, if you do have thoughts or concerns, don't call me. You always want to talk to a physician, and if you're in a real pinch, you always want to dial 911 first.
Exactly.
Before you do anything like that. I mentioned this was a special occasion. Dr. Waldrop's daughter is our own Caroline Waldrep.
Yeah.
It was nice watching while
great.
Caroline was doing the traffic report.
Yeah.
I could see between the two cameras, you and your wife sitting there. It was nice to see parental pride.
Oh, it's great to see her. She does a great job, and I think that to start everybody's day off right, they need to watch WCT, especially the traffic report, and then everything will go good the rest of the day.
There's your unsolicited plug.
Definitely.
Doctor,
thank you so much for having me.
Congratulations on the
Appreciate
engagement
that.
as well.
All
Gannon,
right. Oh yeah.
check of the weather.
All right.